It's the Metro on WDET. I'm Robin Vincent. Reported Lyme disease cases have quadrupled in Michigan in the last few years. And it's estimated that the true number of cases is 10 times the reported number. Lyme disease is spread by a certain kind of tick, the deer tick. The Metro's David Lyons spoke with Dr. Jean Tsao, a tick researcher at Michigan State University, to understand why so many people are seeing ticks now, where ticks are hiding, and how to keep them off of you.
Lyme disease is getting into our consciousness here in Michigan like it hasn't before, and that's because we're seeing a lot more cases. Can you tell me, what is the picture like for Lyme disease in Michigan now? Why are we all of a sudden hearing about it a lot?
One reason is because the ticks that transmit the Lyme disease pathogen, which they go by two names, the black-legged tick and the deer tick, but it's the same tick. But they've been spreading throughout Michigan, and the earliest population started spreading in the late, I would say, 1980s, 1990s, but starting up in a small area in the Upper Peninsula, Menominee County. And then in the early 2000s, populations were found in southwest Michigan, in Berrien County and Van Buren County, etc., but southwest Michigan. And it's just taken time, 20, 25 years, for those ticks to spread. So at a state level, we're really hearing about it now, in part because now the ticks have really gotten through a lot of southern Michigan towards southeastern Michigan, and then also moving up towards central Michigan. But it's been on the west side of Michigan. So much of the state now has these ticks that are capable of transmitting not just the pathogen for Lyme disease, but also for anaplasmosis and babesiosis. And those are less common here in Michigan, but I guarantee you in the next couple of years, we will hear more about them as well.
So yeah, there's other tick-borne illnesses as well. And so what you're telling me is that since the 80s, which 1982 is a really important year as far as Lyme disease goes, because that's the year that in Lyme, Connecticut and the Northeast, it became more of a clinical diagnosis and treatment issue for Lyme disease. And before that, it was not something that was kind of officially dealt with by doctors as Lyme disease. So the 80s are a time when we hear about Lyme disease really kind of taking shape in the Northeast. But you're telling me that the deer tick or the black-legged tick really wasn't even in Michigan very much until that time. And now it's really been spreading through our state.
Exactly. And I would also just say that it was in the late 60s, early 70s that the tick was detected both out, and Lyme disease actually was detected in Wisconsin. And it was about the mid 70s it was first probably detected in Lyme, Connecticut. But as you said, it took a little while before people realized there was this disease. And then it was named Lyme disease because that was the area where it was really thoroughly investigated.
Mm-hmm. I mean, I've even come across in my research that Ötzi the Iceman, who is a famous mummy who was
Right.
5,000 years ago, had Lyme disease. They've seen the bacteria in, I guess, the tests that they did, and other tests have shown that the Lyme bacteria was endemic in North America, even pre-colonial times potentially. But that, of course, would rely on the host, which would be the black-legged tick or the deer tick, being in a given area. And in Michigan, it's just very recently that they're starting to expand. I'd like to ask a little bit more about that expansion in southeast Michigan here, because we have a lot of people who don't think that we have ticks or Lyme disease in southeast Michigan for good reason, because it's very new for us. What causes the expansion of a population of ticks?
First of all, any tick, to be able to live anywhere, the abiotic conditions or the environmental conditions have to be conducive. All right. And for the most part, I'll just say without naming them, Michigan, is conducive.
Mm-hmm.
I mean, the same conditions pretty much are in the northeastern US as well as in the upper Midwest on the other side of Lake Michigan. And then tick also needs hosts. Ticks are obligate bud feeders. So they have to have the host to feed on. And in this case, this tick is not a picky tick. It can feed on so many different small mammals, birds, medium mammals, large mammals. And if we were in the South, I would also say lizards. And so the white-footed mouse is really important because not only do the larvae and the nymphal life stages, those are the young life stages, feed on white-footed mice, that host is a really good host for the Lyme bacterium. All right. And then the adult stage feeds predominantly on medium and large size hosts, but in our areas, the white-tailed deer, the white-footed mouse, and many of the other hosts that these ticks feed on are just abundant and prevalent throughout Michigan.
Mm.
So once the tick somehow got here to Michigan, it just really started to, found its hosts easily. And these ticks don't move on their own. So the fact that it moved from, let's say, Western Michigan over to Southeastern Michigan, most of that is probably due to the fact that it's riding on the backs of little mice, medium-sized hosts, and certainly deer, and then perhaps on the wings of birds.
Mm. So it's very interesting. The ticks don't move themselves, like you said. And I've heard it referred to as questing, where they're kind of hanging out on the edge of a piece of
Yes.
grass or something, and they're waiting for something to pass by and hitch a ride. I would like you to kind of tell us a little bit more about the behavior of ticks and how it takes them into the suburbs or the city, because personally myself, a month ago, I woke up in the morning with a large mature tick on me, and I was inside and I had just been in my backyard and at a local playground the day before and hadn't been doing any deep woods outside stuff. How do we get ticks coming all the way from the deep woods and country areas where we have lots of deer to just be in our backyards? I mean, how prevalent is that?
These ticks, although the woods are their favored habitat, depends on where their hosts have taken them. So if in that playground area, if there are some hosts that were able to, pass through or bed down, and sleep at night somewhere in there, eventually the ticks that finished feeding on it would detach and drop into the leaf litter or grass areas. And if it was conducive for them to develop and molt into the next life stage, which can take a month, could take 3 months, could take a year before they're active again. But if they're able to survive that, then they'll be there waiting for anyone who's going to come by.
You're listening to the Metro on WDET. I'm David Lyons, and my guest is Dr. Jean Tsao. She's a professor in the Fisheries and Wildlife Department at Michigan State University and studies ticks and Lyme disease and how they spread. And we're talking about it because ticks are on the rise, and so is Lyme disease in Michigan, including Metro Detroit. Dr. Tsao. I'm kind of curious how climate change factors into the spread of tick populations overall. I mean, we know that species move based on weather patterns, and it's getting warmer overall, especially in southern Michigan, where we're seeing more white-tailed deer populations, and they're kind of exploding along with the ticks, or the other way around. So is climate change part of the factor here, or is there also neighborhood expansion of exurbs into more rural areas?
I would go, if we had to choose between, door A and B, I would say more so the expansion hypothesis in this case. And that's just because, again, kind of looking at the big picture, southern Michigan is not, it's not like the leading edge, northern edge of where these ticks are spreading. So these ticks have been in Connecticut, New Jersey, Maryland, Delaware. They've been in Wisconsin for a while. So southern Michigan is on par, or with that climate, right?
Sure.
So I think more so over time, our suburbs are such that they not only are they expanding, I guess, closer into more rural areas. It's more that they've converted a lot of the rural areas too into landscapes where it's not city with concrete and jungle, but you definitely have a lot of habitat that's really good for deer as well as the small mammals.
Mm.
And that kind of habitat actually is favoring the deer, and that's why you see expansion of the deer, and the small animals we find too. And so we're creating this habitat that's good for ticks, and therefore increasing Lyme disease risk.
And just to be clear, is Lyme disease kind of the percentage of ticks that carry Lyme? Is that going up, or is it just that the tick population itself is going up and therefore we're seeing more Lyme?
That's a great question. So, what I would say is that most endemic areas with Lyme disease, the proportion of ticks that are infected stays approximately around 20 to 30% of the nymphs, and then about 40 to 50% of the adult ticks that are infected with this pathogen. Now, for when the ticks are just invading, they usually come without as much of the pathogen. I mean, the sense that the tick population has to get set up. And so what happens is in the short term, maybe in the very first, second, third years of establishment of the ticks, the proportion of ticks infected might be lower. But once they get entrenched and you get enough ticks to help maintain the cycle of the pathogen, it usually will go up to about that 20% in the nymphs and pretty much stay around there. So they're not going to be increasing to 40, 50, 60%, at least at the nymphal stage. Then the adult stage usually has double the percentage of being infected because the tick has had two um, chances to feed on a host and become infected. But again, that doesn't go up to 100%. It's usually about 40% to 50% and levels off around there.
Wow. Okay, so that's a pretty high prevalence. I mean, with adult ticks, about
Yes.
half in an area where
Yes.
it's endemic, which includes all of
Right.
southeast, mid south, and west Michigan, plus plenty of areas
Yes.
up
Now, one
north.
caveat. Yep. One caveat is males do not feed. The adult male tick does not feed. So, although it's 50%, you kind of have to discount it by half the population.
Okay, I need to hear now from a researcher who looks for ticks in the wild. I'm assuming you do that as part of
Okay.
your research, right?
Yes.
Okay, I'm looking over an open field. Let's say I'm at a metro park here, and there's a meadow. I'm not going to run
All
through
right.
it because I'm worried about ticks, but I'm curious. If there was a little arrow pointing down to all the ticks in that field, how many arrows am I going to see? I mean, how dense is this population of ticks in these areas where you expect to see them?
Well, let me tell you one thing. First of all, in the meadow, you'd actually be seeing more dog ticks than black-legged ticks. So a meadow, grassy habitat is more the territory of the dog tick, which are the bigger ticks and the browner ticks. And they are out in the spring around the same time as when the black-legged tick adults are out too. But the black-legged ticks, I would say, let's take a little walk down the path on the side of the meadow and let's walk into the woods. And they could be deciduous woods, they could be more pine woods, but generally the ticks need a wooded habitat usually to the black-legged tick to really thrive because it just happens to be a little more prone to drying out than the dog tick. So then if we walk into the woods and you want me to do the arrows, well, it's a little hard because the woods vary.
Mm-hmm.
But certainly there are some places where if we were to we sample the ticks in the woods by using a white drag cloth, a 1 meter drag cloth. And if we were to drag it for 10 meters, about 30 some feet, on a good day for a tick researcher, you might be able to pick up like 5, 10 nymphal ticks,
Mm.
and but some days 0, and some days it could be 20. So it really varies.
I would love to hear about prevention now because it's very easy with any kind of creepy crawly bugs and arachnids in the case of ticks to feel any kind of little thing and we start wondering, is that a tick? Is that a tick? Alleviate our paranoia. Help us prepare for still being able to go outside. How do you prevent
Right.
ticks from latching onto you and trying to get at your blood?
Well, the first thing I would say is you should have a EPA registered repellent to put on your skin.
Sure, and that's like DEET or picaridin.
Yes, it could also be oil of lemon
Mm-hmm.
eucalyptus. A lot of people I know like that because it smells nice.
Mm-hmm.
And so I would definitely use one of those because those have been tested by researchers to make sure that they would actually repel ticks.
Mm-hmm.
And then what I would do is as a tick researcher collecting ticks, I'm always wearing long sleeves, long pants. I tuck my pants legs into my socks, and I wear tall boots generally. But I know not everyone wants to do that. Then, whatever clothes you do use to hike, if you use them a lot, or the same clothes for hiking, and then also clothes for gardening, you may want to treat them with permethrin.
Mm.
And that's something that you can also buy at many of these types of stores, and you can do yourself, or you can send it away to get it treated, or you can buy clothes already treated with permethrin. And that will actually be good for 60 or 70 washes. And that actually stops ticks, mosquitoes in their tracks. So that, and how you wear clothing, wearing light clothing, that's very good. Then what you want to do is when you go into the woods, try to stick to the trails. Now, many people don't like to do that because they might like to hunt for mushrooms. They
Mm-hmm.
might like to see birds. They might like to see plants. And I totally understand. But therefore, I would say you do want to make sure you have your repellent, your treated clothes. And then importantly, when you come out of that habitat, or when you get home out of inside from your garden, you want to check yourself for ticks. And then to be prepared for the worst case scenario that you do have some ticks on you, then you want to be prepared. You want to have a pair of tweezers, you want to have a vial or a plastic sealed bag, because if you find a tick, you want to remove it and then put it into this container. And then if it has bitten you, clean it up. But then after that, what you want to do is take a picture of this tick, a nice picture, and you can submit it to the Michigan Department of Health and Human Services website, or you can submit it to the mobile health app that Michigan State, University of Wisconsin, and Columbia University have, because at these sites, you'll have people be able to identify the tick for you, and different ticks transmit different pathogens. So that's super important information, because then you can be, your worry could be put to rest if it's not, let's say, a black-legged tick, that you're not going to get Lyme disease.
Dr. Jean Sau is a tick researcher at Michigan State University. She spoke with the Metro's David Lyons. It's the Metro on WDET. I'm Robin Vincent. Up next, now that we have some solid info on ticks, we want to think more about the illness they cause, Lyme disease. Now, it's a treatable illness, but knowing how to identify the disease early can make a big difference for speedy and full recovery. We'll hear about diagnosis, treatment, and a possible vaccine for Lyme disease next on the Metro. Stay with us. It's the Metro on WDET. I'm Robin Vincent. We've been talking about ticks, and that's because confirmed cases of Lyme disease in Michigan have nearly quadrupled in the last few years. And it's estimated the actual number of people who get the disease is 10 times the reported number. That includes in Southeast Michigan. While there is treatment, timing is important, and knowing what to look for can be the difference between a quick recovery and chronic issues that last a lifetime. Dr. Peter Gulick is a professor of medicine at Michigan State University, specializing in infectious diseases. He spoke with the Metro's David Lyons about how Lyme disease is diagnosed and treated.
Lyme disease is carried by black-legged ticks, also known as deer ticks, and we know that the population of deer ticks in southern Michigan, including Metro Detroit, has been really skyrocketing. Some estimates put it as a quadrupling of the population in just the last few years, and we've seen that amount of reported cases of Lyme disease as well here in Michigan. Can we start off with what is Lyme disease? What are the symptoms of Lyme disease, and what does it do to the body?
Now, Lyme's disease is caused by an organism called Borrelia burgdorferi. It's a long name, but it's the organism that causes it. And what it does is it's through tick bites. Tick carry the organism, and then when the ticks bite the person, and it usually, if the tick is removed within a short period of time, less than 24 hours or so, usually it doesn't give enough time for the juices from the tick to get into the human that would transmit Lyme's. But if it's there for a while longer, then there's a higher risk of that organism then going into the body from the tick itself. And then once the organism is in the body, then some of the earliest manifestations is they get a rash. And the rash is right at the site of the tick bite. And it's usually a very characteristic rash. It looks like a bullseye. It's red around the corners and kind of a clear spot in the middle. So when you're like making the diagnosis early, it's something where you have exposure to the tick, and maybe you even see the tick on your body, and you remove it, and then that rash appears, a few days later. And that is a good clinical way of making the diagnosis of early Lyme's disease. That's the earliest manifestation. So people that, have been hiking in the forest and tall grass and things like that have a risk of getting Lyme's disease. So the first clinical condition or first clinical clue that you might have is that the patient is in an area where Lyme's disease is a high risk. When you're done doing your hiking or whatever, inspect the areas of your body where there's hair and stuff, and look for any of these little ticks.
Yeah, Dr. Jean Tsao was telling us about doing daily tick checks so that if you do have one that's actually started to burrow its mouth parts into your skin, that you can feel more confident that you got it off before you got past that 24-hour mark that you mentioned. Because it's really nice to know that if you didn't have a tick on you before and then you found one and you didn't have it there yesterday, you're not really at risk for contracting Lyme from that tick. And of course, I have to say that these are black-legged deer ticks, but there's other ticks in Michigan. Some of them do carry other pathogens, but the Lyme disease is carried only through black-legged ticks, also known as deer ticks. So identification is really important if you do find a tick on you, to take a photo of it, and you can send it in to the state or maybe ask your doctor to identify it. If you could briefly talk about the other symptoms that people experience who have Lyme disease.
Yeah, sure. There's different, like you say, once you get over the early stage, now you're into the more advanced stage where it disseminates, and it goes through several different areas. The one area it can go to is the nervous system. And so when it goes into the nervous system, then you can start to get neurologic problems such as like numbness and pain in your extremities. Or one of the commonest symptoms is facial palsy droop, where you develop like a Bell's palsy, and that can cause the cranial nerves to get affected, and that's where you develop these drooping, and that probably one of the more common neurologic complaints that a person has with Lyme's disease. They can have visual disturbances, weakness, and even meningitis if it gets into the central nervous system. It can also go into the heart, and it can actually damage that. And so what happens is that the heart doesn't send out the stimulus, and so the heart can sometimes develop a block in it. And what you would develop clinically would be lightheadedness. You might pass out. You might notice your heart's racing real fast, and then it stops all of a sudden. Chest pain. Those are some of the symptoms you would get. And then if you went into the ER or something to get checked, they might do an EKG and notice that your heart doesn't have normal electrical activity to it.
Mm-hmm. So a lot of concerning symptoms that they're listing there. The neurological ones, the palsy of the face, numbness and pain and weakness in limbs, and even potentially heart complications. But a lot of those, of course, present with any other number of illnesses and could be as simple as somebody having anxiety or panic attacks. Your heart racing is that. Numbness and tingling can be that. So from your perspective as someone who really teaches medicine, understands how the body works, people don't always know if they've been bit by a tick. How would you approach that as a patient who's going into the ER or maybe to your primary care professional and asking them about Lyme disease? What's the best approach there?
That's a tough one because you don't have any. Usually, you have to have some kind of a basis to make a diagnosis. You have to have either history, exposure, or something. When you have nothing at all, and like you just very well pointed out, these symptoms can be very widespread. They can be from a lot of different things. And you mentioned anxiety and that. Usually, the symptoms with Lyme, like Bell's palsy, is not something that occurs all the time and frequently. And there's other causes of Bell's palsy, but one of the things is during the months of Lyme's disease, that should be one of the differential diagnoses as far as neurologic. Now, I'll agree with you that if they come in with numbness of an extremity or something, usually if it's from anxiety or from bumping or something, it'll go away. It'll get better. But this doesn't get better. It gets worse. It persists. And that's the other thing with it. And the same thing with the heart. People can hyperventilate and get lightheaded, and they can have a tachycardia just from stress and that. But usually it goes away. It doesn't get worse or that. And if you faint, then you have to have a full workup if you pass out. I mean, that's something when you go in the ER, they're going to do an EKG, they're going to do a CAT scan, they're doing a bunch of things. And that's when you start to develop more and more findings on your testing, as well as maybe getting a history that goes along with it, that then you start putting the pieces together. And that's when maybe you get more of a history of exposure and things like that. So it's not easy, but it's something you have to be very astute with.
Yeah. Well, it sounds like an important step is if something feels off, it's worth it to go to the doctor and ask, especially if you've been in a deep woods type scenario, you found ticks on you, or you have a palsy or something that really ticks you off, especially the rash.
Let me give you one of the more common symptoms, and that's Lyme's arthritis. That's the final one that would get you, and that's where you would get swelling in sometimes one joint, and the joints most commonly affected are the knees, number one, and then it can go to any joint, shoulder, ankle, elbow. Arthritis is one of the ones that usually tips people off the most because it's more of a physical thing. You can see that joint is a little swollen, a little red, and things like that. So that's the probably the last manifestation that you're going to see with Lyme's disease that many times will bring a person in.
It's the Metro on WDET. I'm David Lyons, and my guest is Dr. Peter Gulick, professor of medicine at Michigan State University. We're talking about Lyme disease, diagnosis and treatment as cases skyrocket across our state, including in Metro Detroit. Dr. Gulick, what is the treatment for Lyme disease? How effective is it? And how does time factor into it? There
is a post-exposure prophylaxis that sometimes they talk about. And this is where you come into the doctor and you say, I've been exposed, I've been bitten, and I'm scared because I think it could be Lyme's. You can get a treatment for that right at that time. And it's usually one dose of doxycycline. So that's one treatment.
Okay.
And if we get into the different forms of Lyme's disease, like, for instance, the red rash, the bullseye that I talked about. In that case, what you would do, there's several different medicines you could use, and it would be twice a day for 10 to 14 days.
Does that typically clear it out? I mean, what happens after you take the antibiotics?
Well, that should be, I can't get, again, the percentage-wise, it's pretty good treatment, and if you do it pretty quickly, because that's the early phase of Lyme's disease before it really disseminates, you have a pretty good success rate of preventing maybe neurologic or carditis or arthritis. So it would be a good way to nip it in the butt, so to speak.
So after the rash, though, things have progressed. Is there treatment? Is there treatment if you really maybe didn't realize it? Maybe you didn't even see the rash and you have Lyme disease and it's progressed a little bit further. What happens if your treatment starts then?
So let's just say the person comes in and they've got Bell's palsy, facial palsy, and the antibody testing is positive. What do you do now? Well, you can still utilize the same drug, and the drug they recommend is doxycycline. Again, now this time they extend the treatment period from 2 to 3 weeks. So you can give it for 2 weeks or 3 weeks, depending upon the severity of it, etc.
I see. I've heard a lot about post-treatment Lyme disease syndrome, and um,
Yes.
it sounds like some symptoms could linger after you have Lyme disease in some cases. Is that true?
Now, that's an extreme. That's exactly correct. And where you see that post-treatment syndrome is specifically most commonly in the arthritic form of it, because what happens there is if you got some response, meaning the patient develops some improvement, but it's not gone yet, it's still there, and you feel like you got it, but not completely. You can actually go to the intravenous one and give that one for 1 month as well. But after you're done with that, then any pain or discomfort that may persist or maybe come about after that is what's called post-inflammatory arthritis. It's no longer the active organism causing it. It's the body's response. It's the inflammation that just never went away. So you develop a persistent inflammatory component. And
Mhm.
that's something that, it's related to Lyme's, but it's not going to be effective with antibiotics. You're going to
Mm.
have to use other anti-inflammatory agents.
So antibiotics seem to be really effective, but there's an escalation of as time goes on and symptoms worsen, the amount of time that you have to be on antibiotics kind of goes up as well
That's
accordingly. And there are
that's
times when there could be some symptoms that don't resolve or they change and become kind of like a post-treatment symptom that sticks around, especially arthritis.
See, and that's the other thing too. What a lot of patients will do is they would come in after this treatment, say for the arthritis, where they had all this treatment, and yet they would still persist with the inflammation. I mean, the pain and the tenderness in the joints, and they would say, "Well, I still have the disease," And if a doctor did do the antibody tests that I mentioned, Eliza, those are going to be positive. They may be positive for life because they're just your body reacting to the organism. And sometimes those antibodies are never go away, even though the infection goes away, the antibodies don't. So you can be fooled sometime and say, "Oh, I'll treat you again and again and again," and it's not going to do any good. It's just giving more antibiotics, and it's not going to really make any kind of sense.
So the post-treatment Lyme disease syndrome thing reminds me of something else, which is really it's part of the Lyme disease in America story, which in the early 80s, Lyme disease started to become kind of clinically diagnosed and treated, at least in the Northeast United States, and started in Lyme, Connecticut is kind of what we named Lyme disease after. But there's been a lot of conversation from people about chronic Lyme disease. So many people have felt very deeply. I have chronic Lyme disease and the doctors won't listen to me. And it's kind of gotten at an issue about trust, I guess, in medicine, in the medical system, in healthcare, because Lyme disease wasn't widely known as a disease right away. And people felt like something was wrong before doctors could really confirm it with scientific peer-reviewed literature. And therefore, there was kind of this lag, and that affected trust. How does chronic Lyme disease, if at all, connect to post-treatment Lyme disease syndrome now? Is there a connection there, or are these kind of two separate things?
Yeah, I know exactly what you're talking about with patients with, and especially the arthritic symptoms. That seems to be the most prevalent, where patients come in and they're just frustrated because they think that they still have the organism. It just wasn't treated with the antibiotics, and they read about it on Google or whatever else, and then they feel like they have this long term complication. And unfortunately, there's a lot of individuals out there that will prey on people like that with alternative therapies, high dose
Hmm.
vitamins and, different types of herbs and other things that, are not going to really be effective, but at least they're giving them something, and they're making them believe that, yeah, this will kill the organism and control your immune system better. So you got to be very careful of those things.
Hmm. And it's one of those things that it seems like what people often really need to know is that the doctor that they're seeing is taking them seriously, which leads me to the issue or the question really of awareness. So how's doctor awareness and kind of just acceptance in the medical field change people's trust in the treatment that's available? Because we know there is effective treatment.
Yeah, and it's a very good question as well. You have to keep re-educating on these things, and they come in waves. I hate to say this, but it's true. Sometimes being a patient, and if you're a good physician, you'll listen to that patient. They'll come in and they'll say, "Hey, look, I think I might have Lyme's," and then start educating that. Just say, "Look, I've been excited," and the person will say, "Oh, yeah, yeah, you're right, Lyme's disease," and it'll trickle a bell ring, and then they'll go ahead and look for it more avidly than just if they came in and just said, "Oh, I have a pain in my knee," and they'll say, "Oh, well, it's probably just you fell on it or arthritis or whatever. Don't worry about it."
Sure, yeah. So, I mean, patients need to advocate for themselves. One way that people can advocate for themselves, or at least act on their own behalf, is with vaccinations, but there's not a Lyme disease vaccine available right now for
No,
people. But is there one on
no,
the
there's not.
horizon?
Yes, there will be. Hopefully, they're working on one, and so I'm pretty optimistic that. And they did work on one for a while before, and then it just kind of fell apart, and just. But they're still doing some active research, so hopefully that'll be a something new that'll really help us in the future. I totally agree with you.
Well, we hope to see the Lyme disease vaccine available from our doctors and at pharmacies and stuff, because as the disease gets more prevalent in Southeast Michigan, across our state, we know that vaccine would be one more way to prevent. Of course, daily tick checks, tucking your pants in, wearing safe and approved repellents are all things that we've heard can help reduce the chance of getting Lyme disease from ticks. Dr. Peter Gulick, thank you so much for taking the time to explain the symptoms and treatments of Lyme disease for us today on the Metro.
Pleasure to be here.
Dr. Peter Gulick is a professor of medicine at Michigan State University, specializing in infectious diseases. He spoke with the Metro's David Lyons about how Lyme disease is diagnosed and treated. It's the Metro on WDET. I'm Robin Vincent. Coming up, more young people are getting colon cancer. We'll try to understand why with a Metro Detroit gastroenterologist. That's next on the Metro. Stay with us.